Hello, my name is Kimber Gosier, and I'm president of Advancing Sickle Cell Advocacy Project, Inc., ASAP. And I am so delighted to be here with filmmaker, warrior, Juliet, Romeo. And we're going to be discussing sickle cell disease and mental health and how it affects your mental health. So Juliet, how are you?
I'm doing good today. Today is a good day. Like my shirt says, not today's sickle cell.
All right. I'm happy to hear that. So Juliet, what would you say some of your biggest issues with your sickle cell disease and how it affects your mental health?
I would say definitely the challenges of being in and out of the hospital, that idea that you are constantly facing your mortality. It can bring on a lot of anxiety. And also, just as a filmmaker doing the work that I do as a documentarian, I feel like it's something I'm always thinking about because I'm creating films and content about sickle cell as an advocate, and also then dealing with it on a personal basis can be, it's just almost like it's around the clock. I'm always thinking about sickle cell, thinking about my health, thinking about other warriors' health. And it can just be stressful and daunting, especially when we lose some warriors. It's just that I'm constantly facing and thinking about my mortality or someone else's. And it's kind of like just a cycle that can really bring on a lot of anxiety if you don't have the tools to really handle it.
I understand. I can definitely understand that. Okay, so you mentioned that sickle cell is an invisible illness. So other people may view you on the outside and think everything is fine. How do you deal with the discrimination from others?
And that was the best thing for me. I think, as far as the stigma and the discrimination, there's nothing we can do about that but educate, because a lot of that comes from miseducation, not understanding what sickle cell is. And like I said before, doing the films and the documentaries that I do, that's exactly what that is doing. It's educating, bringing awareness to what this is, so that now when I do mention on a job or on a set, by the way, I have sickle cell, they know automatically, oh, well, she's going to need a lot of, hydration. And I don't expect people to know automatically. I want you to be like, oh, okay, well, what can I do for you? What do you need? I don't expect you to already know. I just expect you to be open to what I may need and be able to help and support me with that. And that's the best that we can really ask for.
That's great advice for people out there to hear that. Be willing to learn and be open to understanding what sickle cell disease is. So that's very, very good. A good point. And you mentioned explaining to your family and your friends. So clearly you have gotten to a place where you feel comfortable communicating. What will you suggest to other warriors that are in a position that don't feel comfortable communicating, don't feel comfortable sharing or even disclosing that they have sickle cell disease?
It was something I just really had to get over. I had to get over that if I wanted to be able to get what I need. You know how they say, the squeaky wheel gets the oil. And it's not about complaining or nagging. You just really have to stand up for yourself. I really struggle with advocating for myself, simply because I feel like just the word advocating tells me that I should be helping other people. So why do I need to advocate for myself? But when things are not being done, someone has to take the wheel and say, hey, this is what I need. My friends and family, they were the easier people for me to be able to speak to, because they're around me, they're my caregivers, they care and they love me and they understand. When it came to healthcare providers, it was a little bit more tough, because I initially walk in expecting, oh, my doctor should know what I need and my doctor should tell me. And that was really the wrong idea. It's almost as if you're meeting someone for the first time, they're meeting you. You need to tell them what's going on. I have a bad habit of when my doctor walks in the room and he goes, "Hey, how you doing? How you feeling?" You just automatically want to go, "I'm fine, I'm good." And this is not the place for pleasantries. This is the place to say, "I'm in pain. This has been hurting me," or "I've noticed that blah 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 has been happening." Whatever the situation is, like, this is a person that you can trust. You know, we have HIPAA laws. You don't have to worry about feeling ashamed. This is the person that can help you with all the most embarrassing things that you could possibly think about that's happening to you. You can talk to your doctor. You may not feel comfortable telling your parents or telling your friend. And even if you could, what can they really do to help you? If your doctor knows, then he can run tests. He knows what's the next step if you tell him exactly how you're feeling. So I think that, and I don't think that that's an issue just for patients with sickle cell. I think that a lot of people struggle with really being able to speak to their doctor. But it's really important for someone like a warrior to really be able to open up to their doctors. Like we talked about earlier about building awareness. Even our healthcare providers, there is a block on understanding of what sickle cell is. And that's another place that we can also help to kind of, you know, create a full circle and build understanding between the healthcare and the patient. And so I think that that's the best part. That's the best thing to do, is to really be honest and talk to your doctor about what you're feeling and how you're feeling. And if you don't feel like you're getting the right response, just ask them, so are you refusing to give me a response or give me some sort of answer to what my issue is? Because they can go and get a second opinion from another doctor or whatever. But just kind of really, you know, you have to be consistent. I know we don't have that much time, but I've definitely had to be persistent about things that I've wanted, you know, treatment that I may have heard about, that I would say, "Hey, I've heard that from another sickle cell warrior that this new treatment is out. Can you provide that?" And I got a lot of pushback, but I continue to be persistent because this is my life. Like, no one else is going to care about it more than me. And if I want people to care, then I have to continue to be persistent and push. So that's the best that you can do. It is, from a mental health perspective, it's hard, because it's like, why do I have to go through all of this? Why is it such a struggle? Why can't you just, why do I feel like I don't matter? And maybe that's what we need to ask. We need to get the answers. But if we're not saying anything about what we're feeling, then, you know, it's just not going to come out, and we'll keep getting the same treatment.
Yeah, absolutely. I'm glad that you have been able to navigate through your journey with sickle cell disease, your mental health. So this type of discussion is very important, because it gives other warriors, not only other warriors, but the healthcare community, insight that they normally might not see. Yeah. So I think that's great. And thank you so much for talking to me today. I really appreciate it. And we definitely wish you all the best with your future endeavors, your current endeavors, and everything you do. So we hope that you have learned something today. Thank you so much, and we'll be seeing you soon.